Continue that on that thread, we have a gentleman that I met with last night who has come all the way from the US with a very, very large healthcare company. And I was really surprised that they have 23,000 employees in India. John Santelli is the CIO of at Optum, which is a very, like I said, a large services, healthcare and services company. He also leads Optum technology strategy, planning, and coordination. And he's been there since 1986, leading this effort. And as he likes to say, it's innovation is the heart of everything in healthcare, and it's all about technology. So please welcome John Santelli.
Thank you, Mark. Thank you so much. Well, good morning, everyone. Oh, come on. Good morning, everyone. Good morning. All right. Well, it's great to be here, and thank you so much for inviting me into NASSCOM. It seems like really a terrific event, and I'm glad to be part of it. I thought today I would share with you really some innovations for really important healthcare work, and I thought I'd take you into some great ideas on using emerging technologies to solve some of the hardest problems in healthcare. And I think there are problems that really transcend the world, so hopefully they'll resonate with you. But before I get into some of what we're working on and how we're doing it, I thought maybe I'd share a little bit of background on myself. You know, I have started in 1986, and I started actually in BPO. I paid claims, answered phone calls back in the mid-'80s. I did this while I went to college for engineering, and I did it during summers, and then when I was getting my graduate degree, I actually also continued doing ITO, BPO work in healthcare. When I graduated from graduate school, I was able to get a job to help rewrite the administrative platform that I used to work on as a BPO. And from there, I engineered many, many solutions in healthcare for probably a good 15, 20 years. And I moved up the value chain over the years to leading engineering, to managing infrastructure, to being responsible for strategy, the direction of the company, the investments we make, and then ultimately innovating and really understanding where healthcare was going, what are the biggest problems, and how do we bring technology every day to bear to help solve some of these hard problems. And it's a hard journey. And I think it's very similar to the journey India has been on. I've been very involved with building our India team here for the last 12 years. And I think many of you can relate to starting with BPO and you know, calls and claims and administrative process work, and over time, technology work, getting into really the lower end of the spectrum of maintenance and QA and things of that sort. And we spent the better part of a decade really investing in our folks to learn the healthcare system. And I like to call it from the inside out. That's how I learned. I learned as healthcare changed, the technology had to change. And so I learned healthcare really from the inside out. And I think our India operation has learned healthcare from the inside out. And I think many of you have learned industries from the inside out. And as you grow and mature, you add value as you move up the stack, as you move from, you know, QA and simple order tasks to the highest value where you become product engineers. And now you're not only looking from the inside out, you're looking from the outside in, and what the market really is demanding, and where you see the opportunities in the future, and how do you organize yourself and really enable this innovation to happen, because it isn't just by happenstance that people just come up with good ideas. You have to also enable a system of support, enable a system for people to innovate and to be able to take the knowledge they've learned all these years about certain marketplace from the inside out and be able to look at the opportunities in the future and enable them with a system to really innovate. So hopefully that resonates with you. I know I think your mission, you know, product, Mission 2020, it sounds like an if-then statement. You know, I think it's an absolute. I would tell you, we have large commercial products right here in India, right here in Bangalore, that we've been having led out of India for a number of years, and I see that continuing to grow. So I don't see this as an if or when. It's happening now. And the real question is, how do you enable your system, the people within it, to innovate? How do you give them the flexibility and the freedoms, the funding to actually take their ideas, the knowledge they have on the inside as they learned each of these different industries and apply them more broadly? So hopefully that resonates with you. So let's get into it. I wanted to talk a little bit about Optum. I know everybody struggled with this clicker. Okay. I like to start with our mission, and I think this will resonate with you. It's very simple. It's helping people live healthier lives and helping to make the healthcare system better for everyone. And I love this mission because it's really around how do you help the individual in their care journeys? How do they get better quality outcomes? And as we all know, healthcare systems, broadly speaking, around the world are broken. The way we fund care, the way we have access to care. I think in India we have some of the biggest challenges with rural care and access, as you can imagine. And so I love this mission because every employee can take what they do, whether it's a physician, administering care services, or a software engineer writing software, or someone doing administrative work and call processing, can all relate back to this mission. Optum is a really interesting company. It's part of UnitedHealth Group, which is one of the largest healthcare companies in America, perhaps the world. And the concept is not to be an insurance company. The concept is to bring constructs of the healthcare system, like pharmacy care services, like software insights for healthcare analytics, like care delivery, the actual physician, clinicians, and ambulatory settings to actually deliver services into the marketplace, and bring that together to an organization at scale that can help transform healthcare. I think you would all agree healthcare is a challenging system and it's ripe for transformation. I mean, if you look at other companies, other industries like travel, retail, and the likes, financial services, they've all gone through a major transformation and they've forever been changed, right? The digital transformation. Well, healthcare is right in the middle of that transformation right now. And Optum was designed to help figure out how do you actually start lowering costs of care, improving access, and improving outcomes. Optum is a global organization, and it is fueled by technology. And I'm really proud of our Optum Tech organization. We are over 20,000 people strong, and India has been a big focus area for over 12 years. And so we are a global enterprise. Just to give you a kind of sense for the scale of Optum technology, we are probably a 20+% of the healthcare system in America. If you think about all the healthcare transactions, the payments, the referrals, the clinical services, we support probably upwards of 20% of the entire marketplace. So that's something like 2.5 billion claims a year, 1 billion portal transactions. We support probably 1 trillion transactions annually for the healthcare system. So we have a meaningful presence in the healthcare system in America, and that is expanding rapidly into South America and Asia and Europe. So very exciting because we believe the services of Optum and the technology products and offerings we have really transcend the globe. Okay, so enough about Optum. Let's move into really some of the most challenging areas of healthcare. And I look at these kind of in 4 big buckets. It's consumer engagement, data interoperability, preventative medicine, and access to care. And I'm going to talk to you about these challenges and some of the ways in which we're applying emerging technologies to these hard problems. Consumer engagement, before I move on, it's really interesting because you have healthcare in this transformational state, right? We know it's going to have to go digital. It's going to have to feel like retail and finance and travel, in the digital era where you can do everything on your phone and get access to care. That's where things are happening and really reducing the price of care. But at the same time, you have this explosion of emerging technologies. Social mobile cloud and big data has forever changed the compute landscape. If you think about, your traditional players and how software is being built, the Famiga group has really changed that forever. And so if you look at kind of what's happening right now in the marketplace with healthcare transforming and all of these great emerging technologies and social, mobile, cloud, big data, all kind of coming together at the same time, this is the perfect kind of combination to have really healthcare accelerate and transform to really the next generation of services. So very exciting time, and I would tell you the opportunity is right now. Some of the best and most important solutions are happening right now. This is the era of healthcare transformation. And I believe some of these emerging technologies can really start to solve the access problems, can really start to solve the problems of the increasing care costs that we have that burdens all of the world. So let's talk a little bit more specific about some use cases. So consumer and patient engagement. It's pretty well known that the consumer, us, we're responsible for our health care as much as your insurance or your caregivers. And it's in the US, it's commonly known that consumers are responsible up to 50 cents on the healthcare dollar. The decisions you make, the way you take care of yourself, whether you go to a physician, whether you manage your weight, whether you decide to go to an emergency room or not, all those things add up and they can cost money. And so education and engagement is a critical part to solving some of the cost challenges that we have in care. And then access to care has just been a problem in general. How do you get rural areas to see specialists? How do they pay for care? So there's a number of real serious challenges that are going on. And what I would tell you is what's really exciting is IoT. If you look at what's happening in the IoT marketplace, we have a tsunami of medical devices that are coming into the industry. And these devices, if you think about, some project by 2025 that we're going to have 10 devices per human on the planet. I mean, think about 10 devices. We're each going to have, all these different wearables, and our refrigerators are going to talk to us. Life's going to be very different. And the internet itself will change, right? You're going to have really the Internet of Things. We've talked about it for a long time. But you think about the data that is streamed from these devices. Today, the internet's dominated by video. I think you'll see the internet really dominated by these devices and these new era of streaming. And what's interesting about these is if you apply these devices to healthcare, it can really fundamentally change access. So you think about rural areas, and you have video and Skype and things like that, but it isn't all about just being able to see your doctor. It's really about the telemetry in the home. And as these devices become affordable and pervasive, you're going to see in-home healthcare explode. You're going to see chronic illness, which is the most costly part of healthcare, being able to be managed at home by devices. Devices that can predict chronic heart failure, that predict a diabetic event, potential of a stroke. And all of these are happening in real time, and we can intervene. And we can intervene differently than we have in the past because time matters with many of these, like strokes. And so being able to have these devices really change the responsiveness of the healthcare system, the awareness of the healthcare system, and the awareness of the consumer are going to be material. And I think it's going to forever change how care delivery is as these devices come on mainstream. And what's really exciting too is you have the digital era where you can take all these devices and actually manage them through digital means. So your caregiver, your care support team, instant messaging, and a variety of other digital means can actually bring care services together around your data when you have these devices to help you manage a disease like diabetes. So really in your lifestyle, which I think is going to be key going forward. We always take people to healthcare, and if you think about it, we're starting to take healthcare to people. Very different paradigm. Data interoperability, this is a big challenge everywhere, is how do you share data across the healthcare system? It's been known that over $200 billion of waste in the healthcare system because of lack of interoperability, siloed data, the fact that hospital systems constantly do labs and radiology over again because we can't share that data. So there's tremendous waste in the system. How do you start solving that? We're really excited about blockchain. We think blockchain as a kind of a shared ledger has the ability to enable data sharing in a secure fashion and start to take the waste out of a lot of the manual processes and actually share images and EMRs and other kinds of records that are critical and start to take a crack at that $200 billion of waste. And so we're in the process of sharing provider data. I know it sounds pretty simple, but honestly, sharing demographic data is very hard. If you can't produce a directory, how do you find a doctor? How does someone know where to go? If you can't produce a demographic record, how do you reimburse a physician? So it's a critical element of the healthcare system. And if you think about blockchain broadly, could it be one of the secret sauces that helps really break down the barriers of these silos and allows data to flow in a secure manner? And there's all kinds of use cases you could think of, like patient record exchange, provider quality exchange, insurance payments down the road, supply chain management, end-to-end tracking of pharmacy. This could open up a whole new way of healthcare really interoperating, which is fundamental to helping to shift the cost of care. Preventative medicine, I think this is really an exciting area. Big data, I love big data. Healthcare data has always been latent, old, very structured. And now we're moving kind of into this era where we're combining enriched data and other sources and unstructured, and we're moving to better data to create predictive models. But where we're really going is IoT, so real-time data, so moving from retrospective to real-time data, and then eventually genomics, which potentially is the biggest data set we've seen, as well as the most predictive. And why is this important? Well, we take all this data, and as many of you know, big data is the fuel for AI and ML. And we need to start answering the hard questions like, what are my gaps in care? How much do these physicians cost, these procedures? Where's the best place to have the procedure? Who are the highest risk patients that need intervention? It's known that 10 to 15% of the population have chronic illnesses, and they can drive 60 to 70% of the cost. In America, we have a 7% medical cost growth rate, which is a real challenge. It's not a sustainable system. They project by 2025, the healthcare could be 20 to 30% of the GDP of America. It is not a sustainable system. We have got to figure out how to bend the cost curve down, and we can't have this outpacing salaries and the GDPs of countries. So, I'm in a couple of really, I think, interesting use cases that could be profound to the healthcare industry. Reducing hospital readmissions. This is a very costly thing. So how do you get a patient for a particular procedure to the right care setting? We've been able to build, through all this big data, a predictive model that allows us to say, for an individual, for a procedure, this is the best place to have, the best care setting to have your procedure, and you'll have the best outcome reducing readmissions. We're really excited about this. We've had this in production since the beginning of the year in a small venue, and we've seen a 4% reduction of readmissions. Okay, 4% sounds small. It's a big deal. It's about 5,000 reductions in readmissions, which saves about $200 million. And so now we're going nationally. And there's all kinds of disease states you can think about and how to have inpatient surgeries be routed to the right place to really improve the outcomes. And think about the patient, right? If we can get them to the right care setting, how big of a deal is that? I mean, even us, how do we know which specialist to go to? What's the best place to have a procedure? So this is, I think, a profound change in predicting where people should go in the best care settings. Another one is diabetes. I know this is a challenge not only in the United States, but here in India. It's a $30 billion problem, and we have about 30 million people that are diabetic. Another 86 that we predict are going to have diabetes. We built a predictive model that at 87% accuracy, we can predict who's going to be a diabetic. Why is that important? Because we can intervene and actually prevent the disease from happening. This is really important because if you think about an individual, when you have diabetes, your quality of life has changed forever. You can have comorbidities. You have to manage your insulin. And not only is it difficult for the patient, a diabetic will cost 2.5 times a healthy person to the healthcare system. So imagine being able to predict with a high level accuracy who's going to be diabetic and intervene before the disease starts to happen. That is a great way to start bending that cost curve to prevent the disease from happening in the first place. having better patient outcomes, reducing costs. Very exciting. Think about all the disease states that could apply. And then lastly, I'm going to leave you with a little tickler, the human genome. This is the biggest data probably around in healthcare, and it's really in its infancy, but it's gaining traction very, very fast and has potentially the greatest predictive value of any data we have in healthcare today. 2003 was very expensive to build the first genome. Today we're looking at about less than $1,000 in a day or two to produce a whole genome sequence. And then if you look, we have about 500,000 people sequenced. And I think if you turn the clock forward, you're going to see 500 million people, 300 million, 500 million people that are going to have their genome sequenced. And this is important because when you have your genome sequenced, it is highly predictive. It knows if you have genetic disorders, congenital related. And when you start to add the genetic data with phenomic data, the labs, the EMRs, the insights that we have on you in biometrics together, you have potentially the most predictive model of your health ever. And if you think about, how do you prevent disease and how do you bend the cost curve? I'm giving you a glimpse in the future, but this could be one of the greatest sets of data in building predictive models in healthcare. And where could this go? I'll give you an idea that we're working on. It's called My Digital Twin. So if you can predict highly your healthcare using genetic and phenomic data, imagine you could then find a patient like you, really very closely like you. And perhaps they're a cancer patient, and perhaps you could see their care pathways. And what were the pathways that had the best outcomes, and what were the pathways that didn't? And could you follow those pathways as an individual? And could we improve the outcomes of chemotherapies and other kinds of treatments for individuals? So really getting to precision medicine in a whole new way. So anyways, to close, the healthcare opportunity is upon us right now. It's really an exciting time. I've been doing this for over 30 years, and I've never been more excited about changing this landscape of healthcare. And I think if we apply these opportunities, these new emerging technologies to these really hard problems globally, we can really improve the outcomes of patients, their experiences, and we can really reduce the cost of care. With that, I thank you very much.